Hello, everybody. This is Dr. Gita Mathai, and this is my Health Vibes channel. Today, we are going to talk about a very common problem, that is pain in the heels of the feet. We spend a lifetime standing on our feet from the time we learn to walk until we can no longer stand up and have to lie down all the time. The we expect our feet to work silently and efficiently, and most of us do not look after our feet properly at all. After tolerating all this use, suddenly, particularly in women over the age of 40, there is excruciating pain when the foot is placed on the ground in the morning, first thing when they wake up. After a few steps, this pain disappears, so the women don't take it seriously initially. The pain doesn't appear with exercise, but it appears again with rest if you stand up after resting for a little while. This is very typical of plantar fasciitis, which is a pain in the thick band of tissue called the plantar fascia, which connects the base of the toes to the heel. This is likely to get inflamed and cause pain in older people, usually over the age of 40, in women. And if there is any disease like diabetes, because diabetes damages the fascia and the little damages that occur are replaced by fibrous tissue, which is inflexible. It is also likely to occur if you're overweight. Your BMI should ideally be 23, which is weight divided by height in meters squared. If it is more than that, and you spend your time standing on your feet, the feet get pressed down and are likely to become painful. And if there are no particular tests for plantar fasciitis, if an X-ray is taken, sometimes the heel bone appears a little thickened or there may be a spur. But all the people who have bony changes in the heel do not have pain. There may be no changes at all, but still the person should be investigated for diabetes, for gout with a uric acid level, vitamin D levels, and calcium. It is not necessarily only old people who develop plantar fasciitis. It can occur in young people also if they suddenly increase their level of activity or change the type of exercise that they do. Also, people need to stretch before and after doing exercises, and a lot of people don't do this and they think it is a waste of time. The footwear that young people wear when they exercise should be absolutely correct and should have a cushioned sole. If you are a runner, then your footwear should be replaced every 400 kilometers or 6 months. And shoes should definitely be replaced if they show the slightest bit of wear and tear in the heel and the sole. How do you treat this plantar fasciitis? First of all, take a basin, take warm water in the basin and put salt in it. Stand in the basin and rock from toe to heel 20 times. Then, after getting out, apply ice to the bottom of your heels, and then you can also take some mild painkillers. But the strange thing about plantar fasciitis is that it tends to disappear on its own after 4 to 6 months. So whether the treatment that you did worked or not is difficult to determine. Also, if you develop the slightest hint of plantar fasciitis, do not walk barefoot in your house. Buy a pair of rubber Hawaii slippers with bumps in it, the acupressure slippers. Wear that. Wear flats and not heels when you go out. And make sure that your shoes have a cushioned sole. Online, you can buy a heel cushion and wear it all the time when you walk inside your shoes and inside your slippers. All this will help, but if there is no response and you're still having pain, please consult an orthopedic surgeon. You might need injections into the plantar fascia, you might need ultrasound and stretching, and worst of all, you might need surgery. But surgery should be only a last resort. Stay healthy, stay happy, remember the guidelines for exercise, keep everybody around you healthy and happy. This is Dr. Gita Mathai signing off. This is my Health Vibes channel. If you liked what you heard, please subscribe by pressing the bell button. The same content is available in Tamil. Thank you.